My name is Geoffrey Muganzi, a nursing student at Northwest Iowa Community College. I completed my preceptor experience at Sanford Health in Sheldon. My preceptor rotated between the emergency room, medical surgical unit, and a little bit of obstetric, which allowed me to care for patients with varying acuity levels or issues. Throughout this experience, all assessments, analyses, and clinical decisions were completed collaboratively with my preceptor, and we covered a wide range of patients. But there is one patient that I'm going to talk about who stood out to me during the experience when he came in the doors of emergency room complaining of shortness of breath and the rest, as I'm going to talk about, that turned out to be an acute exacerbation of congestive heart failure. So when this patient, when he came around, he presented with shortness of breath, complained of fatigue, had bilateral edema that was 4+ pitting edema. He had difficulty lying flat. He was 89 years of age. His vital signs, when we checked them, showed decreased oxygen circulation. I think that time it was, if I'm not mistaken, it was like 85%. And his blood pressure was elevated. So the patient reported weight gain, and compared to the last time he was in the hospital, and the time he came around, there was a difference of almost 16 pounds added, which is not too long ago when he came to the hospital. So that looked like fluids in the long places of the body, third spacing. So all these cues were identified through joint assessment that I had with my preceptor when she was covering the ER. So she helped me and guided me through during my clinical reasoning behind that. So me and my preceptor, we analyzed the findings together, checked his lung sounds. We had crackles in the bases. The edema, we interpreted it as a sign of fluid overload related to but decreased cardiac output. And of course, when you get all that, you have to share it with the ER provider, which was a nursing practitioner at the moment. So the priority nursing problem identified here collaboratively with my preceptor was impaired gaseous exchange and related to fluid overload. So our expected outcome, we wanted to improve oxygen circulation, decrease shortness of breath, and reduce in the edema. So this safety concern included fall risk and respiratory distress. Before interventions were performed, me and my preceptor reviewed his care plan to ensure patient safety. So we drew some lab. I was able to start an IV. That was my first IV started. We checked his BMP and it was elevated. So in all that situation, we assisted with the patient with elevating the head of the bed, applied oxygen. It was, I think, 4 liters nasal cannula at that moment. We got an order to hang IV medications. That the major one was diuretics, so that they start releasing some fluids, and also because he wasn't really at his best with mobility, so we put a catheter in and using the sterile process, and I started that one too, and and everything was documented on their system. That I'm glad I tried, and I feel like very comfortable right now. It's called the Epic Electronic Health Records. So after putting everything together, he was admitted in the medical surgical floor. But before we took him in, the patient's oxygen circulation improved, and the rest was to be monitored on the med-surg floor. So throughout the entire care process, me and my preceptor, we were actively involved. We verified my assessments, asked critical thinking. So this I'm talking about is the preceptor collaboration, and she really helped me throughout the entire preceptor stay at the hospital. Very actively involved. She verified my assessments, asked critical thinking questions, and ensured all interventions were appropriate and safe for the patients. This collaboration helped me strengthen my clinical judgment while maintaining high quality patient care. So I thank her for that. The values, ethics, and beliefs with my nursing care, it was guided by the values of compassion, dignity, and patient advocacy. Caring for a patient with, let me say, CHF reinforced the importance of patient education, informed consent, and respecting patient preferences. So my preceptor emphasized ethical practice and staying within my scope of practice at all times. So with the background of LPN and having worked in nursing home for a while, we have a lot of CNAs that we delegate some roles to in their scope of practice. But in the hospital, I realized that they only have one CNA. So most of the time, all the things our patients need are done by nurses. So we literally, we are nurses, but partly CNAs, because we do everything. So I can't say that I observed everything most of the time was done by the nurses on the floor. So the delegation and the 5 rights of delegations, probably I saw sometimes CNA getting vital signs for nurses, but because I was training, I didn't delegate anything to them. I could literally do everything, because every time they were helping out here and she was helping out here and there. Other times we never had a CNA. They used to come around 3 p.m. and leave at 3 a.m. So the delegation wasn't quite used at the hospital. Regardless, even when they help, the nurses remain accountable and follow up to ensure the patient is safe. Like when they get vital signs, you have to make sure they got vital signs, the right ones. If the patient is in critical situation, we don't let them do it. So in my conclusion, this preceptor experience at Sanford Health Hospital in Sheldon strengthened my understanding all around, but also CHF management, because you study about things, but practically being in it, there is so much that goes on that we don't cover in school. Even the confidence when you're doing what you're doing is paramount. So I'd say the CHF management and the importance of collaborative practices. So the most meaningful part of this experience was working closely with my preceptor to provide safe, effective, and patient-centered care. And this experience has prepared me to be a more confident, absolutely, and a competent nurse, because if I didn't get this opportunity, I would have been in doubt whether I'm gonna be a good nurse or not. So it has really put me out there to see what exactly nurses are expected to do. I believe that the rest I'll learn them along the way, but this was a great opportunity for me, and I can't take it for granted. So thank you so much.